Have you ever heard a ringing, buzzing, or hissing sound in your ears that no one else can hear? It might be tinnitus, a common condition affecting millions. While tinnitus has various causes, one less known culprit is autoimmune disease. Today, we'll delve into the world of autoimmune tinnitus, exploring its origins, mechanisms, and management. The precise cause of autoimmune tinnitus remains under investigation, but it's believed to arise when the body's immune system mistakenly attacks healthy tissues within the inner ear or auditory pathways. This autoimmune response can be triggered by underlying systemic autoimmune disorders such as lupus, rheumatoid arthritis, Sjogren's syndrome, and vasculitis. In some cases, autoimmune tinnitus may occur in the absence of any other diagnosed autoimmune condition, suggesting a localized or yet to be identified autoimmune process targeting the auditory system. The pathophysiology of autoimmune tinnitus involves a complex interplay of immune cells and inflammatory mediators. When the immune system attacks the inner ear, it can damage delicate structures like the cochlea, the organ responsible for converting sound vibrations into electrical signals. This damage can lead to the abnormal firing of auditory nerve fibers, which the brain interprets as sound, resulting in tinnitus. Inflammatory substances released during the autoimmune attack can further exacerbate the damage and contribute to the persistence of tinnitus. In some cases, the autoimmune response may target specific proteins within the inner ear, leading to a more selective and potentially reversible form of tinnitus. The exact prevalence of autoimmune tinnitus is difficult to determine, as it often goes undiagnosed or misdiagnosed. It is estimated that autoimmune causes account for a small but significant percentage of all tinnitus cases. Individuals with known autoimmune disorders are at a higher risk of developing tinnitus compared to the general population. Further research is needed to accurately assess the epidemiology of autoimmune tinnitus and identify potential risk factors. The primary symptom of autoimmune tinnitus is the perception of sound in one or both ears when no external sound source is present. The perceived sound can vary widely, ranging from a high-pitched ringing or buzzing to a roaring, hissing, or clicking noise. Autoimmune tinnitus may be accompanied by other symptoms, such as hearing loss, vertigo, a sensation of dizziness or spinning, oral fullness, a feeling of pressure or blockage in the ear, and sensitivity to sound, hyperacusis. Fluctuations in tinnitus intensity and the presence of other autoimmune symptoms may suggest an autoimmune origin. Diagnosing autoimmune tinnitus can be challenging, as there is no single definitive test. The diagnostic process typically involves a thorough medical history, physical examination, and audiological testing to assess hearing function and identify any underlying hearing loss. Blood tests may be performed to screen for autoimmune markers and rule out systemic autoimmune disorders. In some cases, imaging studies such as MRI may be used to evaluate the inner ear and auditory pathways. A diagnosis of autoimmune tinnitus is often based on a combination of clinical findings, audiological results, and laboratory evidence of autoimmunity, along with the exclusion of other potential causes of tinnitus. While there isn't a universally accepted classification system specifically for autoimmune tinnitus, it can be broadly categorized based on the presence or absence of an identifiable systemic autoimmune disorder. In cases where tinnitus is associated with a diagnosed autoimmune disease, it is classified as secondary autoimmune tinnitus. When tinnitus occurs in the absence of any other known autoimmune condition, it is considered primary or idiopathic autoimmune tinnitus. This distinction can influence treatment strategies, as secondary autoimmune tinnitus may require addressing the underlying autoimmune disorder. The treatment and management of autoimmune tinnitus typically involve a multidisciplinary approach aimed at reducing tinnitus severity, improving hearing function, and managing any underlying autoimmune disorder. Treatment options may include medications such as corticosteroids or immunosuppressants to suppress the immune response, hearing aids to compensate for hearing loss, tinnitus retraining therapy, a TRT to habituate to the tinnitus sound, and cognitive behavioral therapy, a CBT, to manage the emotional distress associated with tinnitus. In cases of secondary autoimmune tinnitus, treatment may also focus on managing the underlying autoimmune condition with medications and lifestyle modifications. Lifestyle modifications, such as stress reduction techniques, dietary changes, and avoiding loud noises, can also help manage tinnitus symptoms. Currently, there are no known preventative measures specifically for autoimmune tinnitus. However, maintaining a healthy lifestyle, managing stress, and avoiding exposure to loud noises may help reduce the risk of developing tinnitus in general. For individuals with known autoimmune disorders, early diagnosis and treatment may help prevent or minimize the development of autoimmune complications, including tinnitus. The prognosis for autoimmune tinnitus varies depending on the underlying cause, the severity of the tinnitus, and the individual's response to treatment. In some cases, tinnitus may be effectively managed with medications and therapies, leading to a significant improvement in quality of life. In other cases, tinnitus may persist despite treatment, requiring ongoing management and coping strategies. Recent research has focused on identifying specific autoimmune targets within the inner ear and developing more targeted therapies to suppress the autoimmune response. Further research is needed to improve our understanding of autoimmune tinnitus and develop more effective treatments to alleviate symptoms and improve outcomes.